Okay. So good afternoon, everybody, and thank you for joining this workshop, Advancing Policy Reform for People Who Use Drugs, Strategies and Opportunities in the Global South. It's great to be with you all, and I hope you had a safe journey to Cape Town. My name is Thomas Brigden, and I'm the Portfolio Lead for People Who Use Drugs at the Elton John AIDS Foundation. Our foundation supports harm reduction and drug policy efforts across 4 continents, and we're proud to be working with a number of partners right here in South Africa. I'm joined by my colleagues Miguel and Betty, and they're going to be helping out with the session today. So as you will have heard in the plenary this morning, there's a real growing momentum for policy reform across the globe. Also, there's a number of challenges, but we wanted to provide an opportunity for those working in this area to come together in South Africa. So we hope this session can help you connect with new colleagues, explore how others are approaching policy reform in different settings, and share ideas to strengthen your advocacy back home. So we heard from the panelists this morning some really, really good ideas and tips. So I know we're eager to jump into the discussion, but before I hand over to our wonderful facilitators here and moderator, I wanted to quickly go over the structure for the next hour and a half. So Miguel is going to help arrange everybody into some groups. And we're then going to dive into the workshop, where we're going to be covering some key themes identified by our facilitators who have been working with the foundation as part of our global strategy for people who use drugs. So they're going to talk in a few minutes about the themes we'll be discussing today. But as you work through those topics in groups, we'd encourage you to think about a few areas. So what's working well in your country? How has this success been achieved? What's not working so well? What have been the barriers to success? And what do you need support on? And think about collaboration. So what can you learn from others working on this issue? And what strategies might also be appropriate for your setting? After the group discussions, our facilitators will do a brief report back so we can capture some of those key themes and ideas. And I'm also delighted that Gloria Biller from the East and Southern Africa team at UNAIDS is here with us today. And she'll be giving us an overview of the new UNAIDS guidance note on decriminalization at the end of the session. If time allows, we can dig in to some of the conversations and have a bit of a Q&A. So we'd like to record some of the conversations just so we put together a report that we can share with you. If you don't want to be recorded, let us know. We'll just rely on our excellent notes. And we're also going to try and take some photos just to capture the day. So again, if you don't want to be photographed, just please let us know. For now, though, let me hand over to your moderator for this afternoon, Ahmed Said. Ahmed is a person who uses drugs from Kenya, a member of the Kenya Network of People Who Use Drugs, and regional coordinator of the African Network of People Who Use Drugs. So over to you, Ahmed.
Thank you so much. Thank you so much, Tom. Ladies and gentlemen, good afternoon. Good afternoon. Yeah, I don't have to repeat the name. I think it has been there. It hasn't changed. And together, just to say, I think once we are here, we have an agreement that we have punitive policies, we have problematic drug policy in our regions that we come from. And we also have channels or chapters that we've been making to ensure we are fighting to make things better for the people who use drugs. And I'm sure seated here we have details. We have NACOSA in the room, which they have data to verify why we need an environment where drug policy should be discussed. We have the UNAIDS in the room. We have all of us who are doing, we have the pandemic with us that really justify. But also, at the same time, we have been having roles and responsibilities. So what are our roles and responsibility as we are in this platform? And also, once we know our roles and responsibility, what kind of relevant question at this moment we should ask? We are having US stop order. We are having funding cuts. We are having a lot of pushbacks of anti-human rights, anti-gender, all these kind of things surrounded us as the community and the activists and the specialists that have been in the front line of ensuring that we have harm reduction. So With us, we are very, very grateful and lucky. We have very brilliant speakers in the room, and I will allow them to start from my far left. This is left, right? Please confirm. This is left, eh? You know, we are told that I don't want to be color blind, but also I don't want to be direction blind. So from my far left, I'm gonna allow our speaker to introduce herself, and yeah, in that order. Here you go.
Hi everyone, Charity Munaring. I am the Executive Director for Students for Sensible Drug Policy International, and of course by the title of our organization, I will be touching on or really focusing on the youth perspective. So really covering what making drug policy work, how we can make drug policy work for young people. We talk about decrim and all of these policy reforms, but young people still seem to be like an afterthought. And as much as we try to protect our young people, our efforts to protect them does also cause some harm. So for example, the landscape in South Africa, there are no harm reduction services for young people and children who use drugs. And so I'm hoping that from my discussions, we might come up with some practical solutions on how to address some of these gaps. Thank you. Oh, and I'm from South Africa. Forgot to mention that. Yeah.
Next.
Hi, everybody. Can you hear me? Okay. Hi, everybody. My name is Fisayo Alao Amiola, and I work with Youth Rights Nigeria as the Executive Director. Youth Rights is an advocacy and a service delivery-based organization. We work with marginalized communities, especially young people who use drugs. I will talk about one of the key things and advocacy gains and wins that we've had in Youth Rights Nigeria is, we establish networks that are able to stand up for themselves and speak, bringing in the community-led perspectives into the national dialogue space in the country. And, I'm going to also be facilitating the session on gender and drug policy. It's an interesting session, and I would also love to hear from every one of you in my booth station, could be here, could be there, but what's working in your country, what's not working when it comes to gender and policy, drug policy, how do we make changes that we want to see, and someone said something yesterday, what do we want to stop? Thank you so much.
Hi everyone, my name is Kiki. I'm from Jakarta, Indonesia. I'm working with LBHM. It's a legal aid institute that we base in Jakarta. My organization works on several issues, but mainly we advocacy for drug policy reform in Indonesia. Actually, in Indonesia, maybe some of you know that we face like a very punitive drug policy Indonesia, and one of the biggest challenges that we also face, it's not only the law itself, but also the moral and religious narrative that mostly shape how people see the drugs issues in Indonesia. And so much of our effort is mostly about how we counter narrative, shifting the public perception from moral judgment to compassion, public health, and human rights. So we realized that with this so much work to shifting the narrative, we cannot work alone, because LBHM itself, we just focus on the legal aid, research, and some programs, but we cannot like reach for the media, the religious, and also the government. So we realized that we need to build like a stronger coalition and alliance. So later in my table, in my booth, we can discuss together about like what we have right now, what we have to do some like stronger coalition alliance, what's the challenges, what's been working well, and how we can strengthen this coalition, and also a license. Thank you so much.
So good afternoon, everyone. My name is Nitaya Panupak, and I'm from the Institute of HIV Research and Innovation, or IHRI, which is based in Bangkok, Thailand. Our work has been focusing on community-led health services. And we are doing this through implementation research to generate evidence to advocate for policy reform, and also through capacity building for lay providers who are members of the communities. And in Thailand, we have had collective efforts in trying to move forward community-led four-pronged harm reduction services under our universal health coverage. And we have been doing this through implementation research. Started small with MSM, engaging in chemsex, their family members, their partners, their healthcare providers, so that they can come together to design what it should look like when we say community-led harm reductions. And then we expanded this to people of all genders, and also like people who engage in any sexualized substance use. And through implementation research, then we have like curriculum, service standards, QA, QI tools, counseling tools established ready for scale up. And now we are working with our National Health Security Office, or INHSU, who pays for all the health services in the country, to expand this to a wider scale so that they can have more data to endorse the inclusion of community-led harm reduction into UHC. So on my table over there, we'll be talking about utilizing evidence for reform. So would love to hear from you which community-led interventions you have been using with potential to change policy, and then which data you gathered and how you use those data. Thank you.
Wow, thank you. So at this point, I think I'm gonna call my colleague Miguel to come and but thank you for coming. Please give yourself a round of applause. Yeah, it's